Is your cough bronchitis or the flu? Imagine you're feeling under the weather and your cough just won't go away. You might wonder if it's bronchitis or the flu. Both are respiratory illnesses, but they have different causes and symptoms. Understanding these differences can help you decide when to see a healthcare professional. The flu is caused by a virus that infects the entire respiratory system. It usually hits suddenly with high fever, chills, body aches, fatigue, sore throat, headache, and a dry cough. These symptoms tend to come on quickly and can make you feel very sick for several days. The cough in flu cases is often dry at first and is accompanied by systemic symptoms like muscle aches and chills. Bronchitis is inflammation of the bronchial tubes, which are the airways that carry air to your lungs. It often develops after a cold or flu and tends to have a more gradual onset. The hallmark of bronchitis is a persistent cough that becomes productive, meaning it produces mucus or phlegm. You might also experience chest tightness, wheezing, mild fever, and fatigue. Unlike the sudden and intense symptoms of the flu, bronchitis coughs can last 4 weeks even after other symptoms improve. The cough in bronchitis is usually stronger and more prolonged than with the flu. To tell them apart, consider how quickly symptoms appear. Flu symptoms tend to come on suddenly and intensely, with high fever and body aches. Bronchitis symptoms develop more gradually, often after a respiratory infection, and involve a persistent cough that produces mucus. Fever in the flu is usually high and sudden, while in bronchitis it is often mild or low-grade. Also, flu symptoms include chills, headache, sore throat, and nasal congestion, whereas bronchitis focuses more on airway symptoms like chest tightness and wheezing. It's important to remember that bronchitis can sometimes follow the flu, so you might experience both illnesses sequentially. If your cough lasts longer than 3 weeks, produces blood, or if you notice worsening shortness of breath or chest pain, it's essential to seek medical advice. Proper diagnosis depends on recognizing these patterns and consulting a healthcare professional for appropriate treatment. If you experience sudden high fever, body aches, and fatigue, the likelihood is higher that you have the flu. If your cough is persistent, produces mucus, and is accompanied by chest discomfort after a respiratory illness, bronchitis is more probable. Always keep in mind that individual experiences vary, and a healthcare provider can give you the most accurate diagnosis. Remember, timely medical evaluation is key to managing these illnesses effectively and safely.